Hello. So my article today is called Affective Arousal Temporarily Precedes Dissociation in Patients with BPD. So I wanted to clear up what affective arousal is. It is strong emotions like fear or anger, fight or flight responses that happen in daily life. In this presentation, I will talk about how affective arousal is a precursor to dissociation in individuals with borderline personality disorder. So just some of the content we're going to go over today. I'm going to give you an introduction to the study, how this study was conducted, the results of that study, some of the limitations of that study, and how it applies to the field of psychology. The purpose of this study was really to understand how an individual with BPD feels right before they start to dissociate and attempt to find out how to regulate negative emotions to prevent a dissociative state. The researchers hypothesized that patients with BPD would have higher daily levels of that affective arousal, so intense emotions, as well as more instances of dissociation between the other control groups, which is patients with other dissociative disorders, DD, and non-clinical control group, NCC. They also hypothesized that there would be negative valiance after dissociation. So basically, after dissociation, they would have less pleasant or unpleasant responses to emotional stimuli. The original sample had 49 patients with BPD, 47 with dissociative disorders, and 49 non-clinical controls. All of the participants that came in for borderline met the DSM-5 criteria, and they were also undergoing a 12-week inpatient behavioral treatment plan in the study. The final sample had 42 patients with BPD, 40 patients with DD, and 39 NCC. For the method, they used a questionnaire called the German Questionnaire for Thoughts and Feelings, as well as an e-diary assessment where the participants used their phone in 15-minute intervals to input data. This resulted in 52 prompts each day, and the participants were asked things like rating their current valiance and affective arousal. The researchers then analyzed this data using the dynamic structural equation model SEMS. Researchers found a significant difference in patients with BPD compared to the other two groups. The patients with BPD reported the highest average arousal ratings, the lowest average variance ratings, and the highest average dissociative state ratings. These results confirmed the patterns observed in the researchers' hypothesis tests. However, there was no significant effect linking dissociation and subsequent arousal. Some of the limitations of this study, there were three. The first limitation was that the samples from the BPD patients were collected in the inpatient clinic that I talked about earlier, where they were undergoing treatment, and the other two control groups were taking those measures from home, so they were not undergoing treatment at that time. The second limitation is the researchers did not provide enough information to explain the changes in affective arousal, so the researchers weren't sure whether the affective arousal state was triggered by intrusive memories, interpersonal conflicts, or other factors. And the third limitation was that a decent portion of the e-diary assessment was missing because some of the participants did not respond to every prompt. As far as future studies go, it was recommended that they included a structured clinical interview to determine the presence or absence of dissociative disorders for future studies. Affective arousal was a new term to me, and once I realized its importance, I think it was incredibly helpful to understanding patients with BPD. Studies like these will make it easier to prevent dissociation in individuals with BPD by expanding the knowledge about how negative emotions can be a trigger for dissociation. Having this knowledge can aid in identifying when the affective arousal is actually starting. And as a clinical psychologist, I think it's important to understand all the antecedents that come from certain behaviors in order to properly help patients. And that is all I have. Thank you so much for watching.